I'm Bill Tobler. I'm one of the Mayfield neurosurgeons who retired about 4 weeks ago. But I'm here to kick this meeting off. This meeting is the brainchild of a number of us here in this room because we realize the importance of continuing education. And we have been able to get a major endowment to make this lecture series possible. So this is our first go at it, and I'm very pleased to see this room completely filled up. And this is called the Herche Lectureship, and I'll talk about Dave Herche here in a little bit. But you are in the Mayfield Innovation Center, and our lecture is entitled the Herche Lectureship in Surgical Innovation. Innovation is one of my favorite words. It comes from the Latin term innovare, to create something new. And this is an important word for me. It's important for Mayfield. It is on the outside of the building. There's over 100,000 cars a day that go by this. We've been here since 2007. And inspiration and aspire are also a couple of my favorite words. If you look at the field of neurosurgery, and we're talking about brain and spine, and brain and spine are kind of two unlikely bedfellows, right? I mean, they're just like totally different, but we do both. And if you look at what our forefathers in neurosurgery were doing back in the 1950s and 1960s, first of all, they're as smart as we are. So that hasn't changed. But the big difference that sets us apart from what we do now compared to what we did then is innovation. And innovation is changing things, introducing something new. And it is a risk-taking proposition. But if you look at what's happened, it's all innovation. All of the things that are done in modern medicine, cardiac stents, endovascular procedures, gamma knife surgery, all of these things were daring innovations that the pioneers took the risk to make this happen. I want to take a moment not only to mention about the Herche sponsorship, but also the partnership with our spine and brain industry partners, who are also enabling us to have this beautiful event, including the reception last night and the dinner tonight. They're very important partners in these endeavors. We would not be here without them. But I also really need to give a big shout out to our Mayfield staff, Sonia Lip, who's putting out a fire right now somewhere, and Tanya Hines, and Deb Livingston, and all the other Mayfield associates who really make this a very smooth, wonderful experience. And hopefully, when you all leave and reflect on what we did this weekend, that you will feel good about it, and that you will think about us in the future, come back and visit us again. Participate also in some of the other events that we have, like the Keller Lectureship, which has been ongoing now for a decade or longer, which is a similar format to this presentation and weekend, and it's in skull-based surgery, and it's named in honor of our beloved Dr. Jeff Keller, who's a neuroanatomist here in this room, and he's been a Mayfield neuroanatomist going back into the 1970s. So here's an overview of the program this morning, and we will be in the lab until everybody tires out, and then dinner tonight at the Capitol Grill, and then tomorrow we'll be back here at 8 o'clock. Sonia, 8 o'clock, yeah. And so we have some presentations by some distinguished innovators in the field of neurosurgery, and I would like to take a moment to thank both of them, Dave Okonkwo from Pittsburgh and Alex Thomas from Wilmington, for coming here and putting themselves out here for us in this intimate setting. It's a great opportunity to get to know some of the renowned people who are leading our field. So I think a nod to this innovation curve is important, because this is really what we're all about, and this is what we're about at Mayfield. And cutting edge treatment is this curve created by Everett Rogers, called diffusion of innovations. He outlined this in 1962, and this has been proven to be demonstrated over and over and over again. And the early categories of the innovators and the visionaries, the innovators might be technical people who create a concept or create an idea. And I could give many examples, but then the visionaries are the small group of people. Some of us in this room, I would categorize into that group, that we are the early adopters. And when we're successful at early adaptation of this, then we jump the big chiasm into the early majority and then the late majority of all surgeons in the group who eventually adopt this new technology and make it successful. And then there are skeptics who come in at the tail end after they've been completely convinced that this is appropriate technology. You could apply this curve to almost every aspect of the practice of medicine and surgery that you see today, and that many of us in this room have benefited from. And so that brings us to Mayfield. And I'd like to go over a little bit of the history here, because there is history surrounding us on the shoulders of the people that came before us. And Frank Mayfield, the founder of Mayfield Brain and Spine, but it was the Mayfield Neurological Institute early on. He was not only an innovator, early adopter, but he was also an expert politician. And I think that maybe some of you in this room have read about some of the things that he has done, but I'm going to go over some of the things that not just Frank Mayfield did, but that others in Mayfield have contributed to our world base of technology, knowledge, and experience. Frank Mayfield actually was a neurosurgeon who was involved in the concept and the design of seatbelts with the Ford Motor Company. And that really doesn't get much attention, but it should get much more attention. And then he being a brain and a spine surgeon then, and I got to say, in my career, which I started in 1985, I've been the beneficiary of being in a historical moment where I could do everything. Now we're so subspecialized, right? I mean, you've got vascular surgeons, you've got deformity surgeons, you've got brain tumor surgeons. Everybody is so subspecialized. But I got to tell you, it was a blast. Clip aneurysms, take out skull-based tumors, and do all kinds of spine surgery when you weren't under the scrutiny and the regulations. I mean, you can't even think of doing an endovascular procedure, right? You've got to be certified. You've got to do a fellowship. So it's a very, very different world. And it was a little bit maybe of the Wild West going back then, because surgeons could innovate and introduce innovations without the burdensome onus of regulatory IRBs, FDAs, and on and on. You guys know what I'm talking about. But Frank Mayfield designed one of the first aneurysm clips, and that's also kind of little known. What he's really known for is the Mayfield skull clamp, which is used worldwide. You can walk in an operating room in Japan and probably in China and find a Mayfield headrest in a neurosurgical center. And as a result of developing the Mayfield skull clamp, which he did with an engineer working in the garage, literally, I mean, everybody, Jeff Bezos worked in a garage, Bill Gates worked in a garage, that's kind of part of the epic story. But We were housed in an old mansion in the center part of Cincinnati. It's a 13,000 square foot mansion that was built in around 1904, and Frank Mayfield bought it in 1952, and it had a carriage house in the back. And that's where they developed the aneurysm clips and the Mayfield skull clamp. Well, the Mayfield skull clamp became so popular so quickly that he formed a company, and it was called Ohio Medical Instrument Company. And the name Ohio Medical Instrument Company went out the window in the late 90s, but it was distributed. The Mayfield skull clamp was distributed by Codman, which was then the big powerhouse neurosurgical company. Now it's Integra. Today is the powerhouse neurosurgical company. And the Mayfield skull clamp generated significant revenue through Ohio Medical Instrument Company. And the first thing that Frank Mayfield decided to do was to form a foundation to put the profits, all the profits. So he did not personally profit from the sales of the Mayfield skull clamp, but he created a fund called the Mayfield Education and Research Fund in 1979. Now, if you look over there in the room, in the corner of the room where you walked in, you see a framed plaque. And you got to take a look at that. That is a list of the original people who donated money to the fund, in addition to the royalties that came in from the sales of the head clamp. And it's very interesting to look at that because I recognize most of all the names on there, and most of those names were floor nurses, secretaries who worked at Mayfield, and doctors who were friends of Mayfield. And we have a list. We know exactly how much money they each donated. Many of those checks were $25, $30. And so over the ensuing couple of decades, the fund grew a little bit, but we never did anything with the fund. But in the interim, other innovations occurred. John too developed special electrodes for the treatment of trigeminal neuralgia. Dr. Richard Buddy developed the Buddy Halo. Most of you in cranial surgery know what the Buddy Halo is. Their pictures and their portraits are all out here in the front hallway, including Dr. Buddy's. And then with the development of computer-based technology, we started doing things, adapting computer technology in the operating room. We developed a Mayfield image-guided system that started originally with a mechanical arm digitizer, and then the optical tracking was developed, which is what everybody's pretty much familiar with now. And we even worked here and developed an electromagnetic tracking system, which is a superb way to work in the operating room, but it's never gained much clinical traction. We introduced the mobile CT. Now I know in Pittsburgh is famous for the intraoperative CT that I think was first installed in Pittsburgh in around 1982, but it was a fixed CT. The image you see here, and maybe you've seen it, maybe you haven't, is a portable CT that weighs less than 2,000 pounds. It was a single slice intensifier, but it provided superb imaging for brain and spine surgery and image-guided spine surgery. And we worked with that. I spent a lot of time personally working with this. And what we did is that we made this feasible for an operating room because the Mayfield Ohio Medical Instrument Company formed a partnership with a Swiss company that made operating room tables. And you will see those operating room tables in the lab here today. But the big problem and the challenge of intraoperative CT was, how do you image the patient while they're in the position of surgery, right? I mean, they could be in a lateral position, prone, supine, and we would take images while the surgery was in process. And we did this both with spine and brain. We developed the radiolucent headrest, the Mayfield radiolucent headrest, and the OR table that made that all feasible. Then we developed the Mayfield Spine Surgery Center. This is the first freestanding spine center in the United States. It has 3 operating rooms downstairs. It has a pain center here, and then we created the innovation lab here. And we do over 1,500 spine surgeries a year downstairs. Some of the more recent technological advances are the different types of techniques to access the spine. One which you're going to demonstrate this weekend is the XLIF. And, you know, when that first was adapted, you could see there were a small group of early adapters, and now this is kind of over the hump, and this is now standard surgery. One other technology that I worked with very much in development is the AxiaLift, which never really got over that big hump. And so it's never become mainstream. But more recently, we've been developing and working with SI fusion and have a lot of experience with SI fusion and deformity. And now we're doing things such as working with NeuroPoint Spine Registry and brain tumor QOD, and now working with AI in the operating room with Viz AI and bespoke 3D implants that we're going to be talking about. And so all of these innovations are not, sometimes we're in the early adapter stage with some of these things, but going forward, we should always inspire to innovate, because we're probably not far off of finishing our innovations. We're only in the beginning of centuries to come of innovations, and future innovations will be built upon what we've done here and what you'll see today. So I will introduce Dave Herche. He is going to visit us tomorrow. Dave has been a friend of mine for a long time, and we have this video to speaks for itself.
We are at the Dave Herche Cincinnati Athletic Club, the longest standing athletic club in the country. 50 years ago, I started as a young man coming to the club. I played basketball here 3 days a week.
He's always had a passion for physical fitness. I think his father used to work out at the athletic club and swim every day, and just gave Dave some good life habits.
I love basketball. I love watching basketball, and I continue to say I love playing. It is a passion that's up at the top of all my wants. And I believe that is why at 74, I'm still reasonably active and healthy. About 3 years ago, I felt the left side of my body, my arm and leg, feeling warm.
He came in the office and he was limping, you know, and it wasn't severe, but you could notice it was almost dragging a foot kind of off. And I said, "Hey, what's going on with your leg?"
And I figured it was just old age. And finally, I had to figure out and ask some questions on what was going on. So we did an MRI and found a small mass pushing against my spinal cord and wrapped around a nerve. It was compromising my abilities to do almost anything. Tobes looked at it, said that it's a tumor, and he told me about what size. He said, "I don't think it's cancerous, but we need to get it out."
It was beginning to affect his spinal cord function. That's kind of code urgent to get in there and get that off of his spinal cord safely to allow him to recover and hopefully make a full recovery. If left undiagnosed or untreated, it would continue to expand until it would just, like slowly turning a light out, it would slowly cause all the spinal cord function to cease.
I knew Tobes from when our kids went to grade school together in Cincinnati. What I liked about him was just a regular guy, let his work speak for itself. What he told my wife and I at the time, he said, "You know, I wouldn't be unhappy if you wanted to get a second opinion in New York or Mayo or wherever you wanted to go." And I said, "I don't want to go out of town. I believe you're as good as anybody in the country. And so let's just do it right here." When I got out, I never had any pain in my back. The warmth went away, and today I've lost a little bit of my skin skill of basketball, but I still play basketball, full court basketball. And I've been very fortunate to be able to have a business that provides me the resources to give back. And I just felt like I wanted to do something for Tobes. He said, why don't you fund a lectureship in neuroscience innovation? And so I wrote a check for $250,000.
The purpose of the lectureship as we envision is to provide a community and regional resource for active training surgeons and practicing surgeons to experience and explore the most up-to-date innovations in surgical technology and technique. We view ourselves as stewards of the neurosciences. We're very honored to have the generous philanthropic contributions from the Herche family, because this allows us to bring in very highly regarded world-class surgeons and researchers in order to enrich ourselves, our professional education, and to also train the future generations of surgeons delivering neurosurgical care.
So the level of care that I got and that is available here in Cincinnati at the Mayfield Clinic is something that we all should support and allow it to grow in prominence around the country.
We are changing the future by investing today in the present.